I loved my job. I would still be doing my elementary principal job today if it weren't for all of the crazy Joe Burrow stuff that happened. So thankfully it did happen, and we were able to start the Joe Burrow Foundation. And but in my time in Meigs County as a principal, I was very privileged to become a part of the School Health Learning Collaborative that Nationwide Children's put together in 2017, I think. I was only a year in as a principal at that point, and got this lovely little email that said, please fill out this survey if you are interested in learning more about school-based clinics. And so I thought, well, that sounds like a pretty good deal. I'm going to fill out the survey. So I did, and then a couple weeks later, my school nurse and I came up here to Columbus and started our learning collaborative. And through that and the wonderful toolkit that you all at Nationwide put together, we were able to find a community partner. Our clinic is not a nationwide clinic. Our community partner, it still is, with Hopewell Health. And we opened the clinic, well, we were supposed to open it in March of 2020, guess what happened? So it got put off a few months, but we did open it the next fall. And we had a little bit of resistance with our community. You know, the building that trust initially is very difficult. But we persevered through all of that. It is a very successful clinic now. A part of that was we had a behavioral health unit on campus, but they didn't really have a home. We had a school-based social worker, and we had a therapist. They kind of just traveled, honestly, found an empty classroom here or there. We knew that if we were going to do a school-based clinic, we needed to help them find a home in our building where they could actually treat children, meet with families to be successful. So a part of our build-out was incorporating behavioral health from day one. It made a huge difference for them initially, for us keeping kids on campus and being seen, and also then that having children go to get their therapy, their behavioral health therapy there, helped to build those relationships with the families and the trust with the families, so the primary care started to come along. And then the next year we added dental, and that was another workshop collaborative with Nationwide Children's. We continue to come up here, and at the end of that then is actually when it was the very last meeting with Mary Kay and Teresa. And I stopped to say, hey, I'm stepping away, I'm gonna miss you guys, thank you for everything. And this is what I'm gonna be doing. We started the Joe Burrow Foundation, and part of our focus is youth mental health. And you know, maybe there could be something that we could collaborate on in the future. I'm not sure if they said that first or if I did, but I'm gonna take credit for it right now. So I don't know, a few months later, Mary Kay or Teresa, one of them reached out and said, hey, we have this idea because we have a really good model that's working well in our school-based clinics here. It's reduced wait times to see child psychiatrists by 4 months. It's amazing. And some other wonderful news that they shared about that behavioral health piece. And so they said, we have this idea that we could collaborate, if we can partner together, I think that we can build this out for other school-based clinics, not just nationwide clinics. So we put together a partnership. The program is now called the Burrow Blueprint. We launched it in August, actually in Baton Rouge, in the school-based clinics there. And then in Southeast Ohio a few weeks ago, Dr. Sarah Bodie is boots on the ground, mentoring those school-based clinicians right now, and it sounds like marvelously. So we're very excited to be able to help those school-based clinicians, not just in those two areas, hopefully it will be broader eventually, but to be able to bring that primary care mental health directly into the school-based clinics is a game changer.